going to be over. It's going to be over the loud. Is it?
No, your mic.
Or just for that? Okay. Oh, gotcha. That's why I just want to make sure. We're going to go ahead and get started. So, as you know, today's topic is managing insomnia without meds. I'm Dr. Robinson. I'm one of the LSU family practice residents here at Lake Charles Memorial Hospital. This is a topic that comes up often in clinic, and often the patients have already, looked at their resources on Google, and Google sometimes doesn't provide the best of resources. But so I'm going to give everybody a little bit of self-help, and also give you a little bit of ideas what other treatment options there are without medications. And I do want to start, thanking Memorial for letting me get up here and talk today. Like I said, this is a topic that comes up pretty much daily in clinic. So, just a quick overview of the learning objectives that we're going to talk about. We're going to define insomnia, and why does it occur, who tends to develop insomnia, why it's important. And we're going to talk about the goals of therapy, the non-pharmacologic therapy, and then, again, the self-management, which is the big one. So here's the complicated medical definition that has a lot of big words and a lot of complicated stuff. So we're just going to skip that and go straight to, all right, this is, insomnia. Are you happy with how long and how well you're sleeping? If not, well, that might be part of it. You're unable to get to sleep or stay asleep. It affects you at home, work, school, socially. Does it affect you anywhere? And for the chronic, for the actual insomnia diagnosis, that's to occur 3 nights per week for 3 months. And this is one I get often as well. It occurs even when you're not recovering from graveyards. Have a plant worker coming in and they just got off nights and they're like, I can't sleep at night. Well, you're going to have some issues with that if your body's adjusted to the nighttime. You're not on drugs. Drugs will cause you to stay awake. And it's not caused by another medical condition, which is, this probably, to me, this is the most important one. Insomnia is often thought of as an actual diagnosis when it's a symptom that's become a diagnosis, but you do want to make sure it's not another medical condition. And it is important to see your primary care or get one in order to rule out other things. And I'm going to talk a little bit about that. And if you do go to your primary care and they just give you a medication and don't really talk to you about these things, maybe consider switching, because it can be harmful, some of the medications. So like I said, there are other causes of sleep-wake disorders. So you have acute insomnia, which is the graveyard worker, somebody who's not yet adjusted back to the nighttime sleeping regimen. There are just circadian rhythm, sleep-wake disorders, restless leg syndrome, which is a pretty common one. It's fairly easy to treat, but it does require treatment if you do want to get over the insomnia. And then, of course, narcolepsy, and then stuff like parasomnia, somebody who has night terrors. If you wake up with a night terror, you're all worked up, you're not going to be able to go back to sleep. So the pathophysiology, again, very complicated probably, but it's not well known why it occurs, but it's hyperarousal throughout the entire day, and there are 2 kind of theories about it. One is called the cognitive model, and the other is the physiologic model. Basically, it's either your brain or your body that's the issue. Your brain's either it's wired, it's just going, and this is the metabolic pathway that we at one point learned in med school, which has since been replaced by other things. But so this is also increased. So who gets insomnia and how common is it? So depending on what study you look at, some said 5%, some said up to 50% of patients or population have at one point in their life insomnia. But if you use stricter criteria, it's like 6% of people, which is still pretty common. Who seems to have it? Women typically get it a little bit more than men. It's more common as you age. And those with other psych or medical illnesses typically get it. And also, as I mentioned earlier, I said you don't do drugs. Well, there are medication drugs that can also cause you to stay awake. This is just a brief, well, not brief, I guess it's pretty elaborate, but some of the things you see that can cause you to cause insomnia. Of course, alcohol, everyone thinks that, it makes me tired. It might help you fall asleep, but it's been shown to decrease the effective sleep time. So when you actually get to sleep, it's not good sleep. This one's kind of a no-brainer, caffeine. We're a country of coffee drinkers, especially here in a hospital, but drinking caffeine at all, no matter what time, can cause insomnia. And then also you have sedatives. So sedatives, yes, they make you tired, but you do grow tolerant to them. And then once you come off of them, then you really have insomnia. You have rebound insomnia, which is also an issue. So why does it even matter, aside from getting good sleep, right? So it's associated with increased visits to the doctor, with days spent with limited activity, increased absence, increased traffic and workplace accidents, decreased job performance, and this is most likely why somebody comes to the doctor, is that it decreases their quality of life. It's also a predictor of medical comorbidities. And so the impact of insomnia on overall health and well-being, it highlights the importance of making treatment options available to affected individuals. I'm going to get into the CBT, which is cognitive behavioral therapy, which is the mainstay of treatment for insomnia. Of course, it's always, I always want patients to go, but it's not covered by insurance always, and time. It takes a lot of time. It takes weekly visits to the therapist, which not everybody can make. So the goals. Why are we treating? What are the goals of therapy? Well, I want you to have sound and satisfying sleep, and I don't want to bother you in the daytime. We also want to treat underlying conditions. Like I said, there are other medical problems that can cause somebody to stay awake at night. We want to prevent it from becoming chronic. I want to talk to you about healthy sleep hygiene. This is the self-management. And then prevent excess use of sedatives. Like I said, medications, they might help you fall asleep, but they're not benign. Anything that causes you to go to sleep clearly can also affect other parts of your health. Somebody has breathing problems, you give them something that makes them sleepy. It's just, anytime I can avoid a medication to sleep, I want to do so. So what's the most effective treatment? I mentioned it, CBT. What is it? So it teaches you different techniques and helps you encourages return of normal, satisfying sleep. Like I said, it takes time. I have a friend who does CBT, and it's 8 weeks, some 8-week programs, and it's weekly. And they're hour visits. And so it's not always, people have work, they have jobs, they can't get to the weekly appointments. And also, everyone wants a quick fix, but getting normal sleep is not a quick fix. Yes, a medication might take care of it, but as soon as you stop taking the medication, you're right back to where you were. And it's putting a Band-Aid on something that really needs a strong foundation. And learning these techniques that I'm going to talk about, they will help you in the long run. And mentioned, CBT is not always accessible. Well, with the modern age, with internet, there's actually online CBT, which of course is much more accessible to everybody. It has been proven to be more effective than medications. They also looked at the CBT plus medications, and there was no improvement in the treatment of insomnia when you added medications. And the 5 main components, I'm not going to go into them too much detail, but there's different ways that CBT does this. So sleep restriction, you know, at first you have somebody, if they're in bed 8 hours a night, well, you get them in bed for 7 hours a night. And the idea is that, you know, we spend a lot of extra time in bed, you know, reading. You know, the bed is for sleep, and it shouldn't be for watching TV or anything else. Stimulus control. That's, I mean, what it sounds like. You know, you turn off the lights. You want to make the environment quiet. Sleep hygiene, teaching you to relax, and then just changing the way you think about sleep. So these are online programs now for CBT. They're pretty accessible. Some of them pricey, but I mean, iTunes has one $5. So if anything, if you get anything out of this, you know, and don't hear anything I say, know that there are resources that are affordable. And these are just, I'm not going to sit here and read all of these, but there's just an example. And also in the handouts, it provides you with the different online training. So the big thing, self-management. So personal habits. You know, you want to fix a bedtime every night. If you stay up late one night, it kind of ruins your cycle, and you have to kind of get back into it all over again. Avoid caffeine. It's kind of a no-brainer. But if somebody's falling asleep, you know, and it's you want caffeine to stay awake, right? But if you drink it too late, it causes you to not get to sleep. Avoid nicotine near bedtime and upon awakening at night. You also want to avoid alcohol 4 to 6 hours before bedtime. Like I said, people sometimes turn to alcohol for help with sleep because it makes them feel a little sleepy at first. But in the long run, it's not. It doesn't help you stay asleep. Excuse me. You also want to avoid spicy foods, which is hard down here. We like our heavy, spicy, and sugary foods. I'm guilty of that. But we want to avoid those 4 to 6 hours before bed. We want to exercise regularly, but not right before bed. The recommendation is any 2 to 4 hours you want to exercise before bed. Any time after that, it it releases hormones. It gets your fight or flight system. It gets it running. So sleeping environment. You want to use comfortable bedding. Actually, last week, not even thinking about the insomnia talk I was about to give, I stopped by. I was like, I'll go look at a new bed. Mine's not too comfortable. I was laying down. I was like, man, if I did have trouble sleeping, you know, this would take care of it. So getting a comfortable bed is important. Finding a comfortable temperature and blocking out all distracting noises. So I put this up there. If you live in New York City, it's a city that never sleeps, right? You've got loud noises. Everything's going. So if you sleep, if your environment's like that, you're going to have trouble sleeping. Or if you have this new thing that's called a sleeping pod, where all sound and light is eliminated, there is oxygen in there, so that is good. It's necessary. But you can imagine sleeping here is a lot better than sleeping there. Yeah, I guess unless you're claustrophobic, and then I guess that's a whole other issue. But so getting ready for bed, things we can do. Well, you can try a light snack, warm milk and foods, high in amino acid, tryptophan. I think everybody knows the joke around Thanksgiving. You know, don't eat turkey and watching a football game and you fall asleep, right? Because too much tryptophan. Try relaxation techniques before bed. Don't take your worries to bed. You want to also establish a ritual, the same thing you do every night, and it helps teach your mind and your body to relax. You know, the mind and the body, they're closely related. You know, if you're worried, get your body worked up, and then also vice versa, your body can get your mind worked up. Get into your favorite sleeping position. I think everyone probably knows what their sleeping positions are. Are you a back, are you a slide, or a stomach sleeper? Go ahead and get into it, and it can also help you get into the sleeping mode. This I actually never thought of this, and I started using this one myself because hiding clocks or wristwatches. I'm bad about that. About when I wake up, like, oh goodness, what time is it? It's only been 2 hours, you know, and I got to get back to sleep. And then you try to get back to sleep, right? You feel like you've laid there for 4 hours, and you look, and it's only been 10 minutes, and you just keep looking. So And then these are some common self-prescribed treatments. Like I said, alcohol. People try to drink some alcohol to make them tired. It does reduce time to sleep and early sleep, but it's highly disruptive of other sleep parameters. And it ultimately exacerbates insomnia. And then antihistamines. These are you see commercials for it on television. And these things like Benadryl, that it might make you a little tired, but it can cause mental and cognitive changes and motor impairment. And especially in the older population, antihistamines can be a pretty dangerous drug because of the side effects. It's got a lot of drug interactions, and so we do want to be careful with those. And sedation may carry over into the daytime. Yeah, you might have gotten good sleep, but you're right back in that position that you were of not being functional with your daytime routine. There are other things: acupuncture, pressure, tai chi, yoga, whatever helps you relax. So why are medications not first line? So this is actually, I took this from the American Academy of Sleep Medicine. So this is the only thing they deal with, right? So they have all these medications listed. Weak, weak, weak. All of it is weak. There's just no evidence that shows they help. These are just people that, they're specialized in sleep medicine. It's expert opinion. There's studies, but they just don't show whether they're good or bad, right? They don't help. There's no evidence that they ultimately help. So this is some resources, and it should be in your packet. The one that I found very useful, and I've got probably a couple of colleagues that are proud of this, being that they're from Nova Scotia, but it had a lot of self-help resources. Kind of helps explain what I did today, hopefully, why insomnia occurs, and it can remind you of what tools you can use to help get to sleep. And then there's also self-management. The Mayo Clinic has a pretty good website too of tips and strategies. So this is the Sleep Well Nova Scotia. Just looking at it, when you go to the website, I was relaxed. The clouds down here move, and the stars, they kind of twinkle a little bit. So I know it relaxed me just looking at the website. So just, any questions? Yes?
I have